Welcome to the Place of Rest, where our aim is to give you language that helps you displace the growing confusion, chaos, and dis-ease of our times. My name is Jonathan Boyce, and it's my pleasure to bring to you today's episode. Returning guest, Dr. Lee Cowden, discusses his work to find hope for those suffering with ALS. We hope you enjoy today's conversation.
Dr. Cowden, thank you for joining me today.
Great to be on with you.
It's been a hot minute since I had the privilege of speaking with you about a subject that is very near and dear to the heart of the medical field. I think it's been a mystery disease to some extent, ALS. Mm-hmm. You've been involved in a significant project. Can you tell us a little bit about what it is and what you're doing and why we have reason to hope?
Yes, amyotrophic lateral sclerosis is a neurodegenerative disease of the motor neurons. And most neurologists tell their patients that have that condition that they have somewhere between 2 and 4 years to live, and that they're going to get progressively more and more dysfunctional during that period of time until they finally die. And so it's a condition that where the hope is stolen away from the patient by the doctor speaking those words. And we've learned that is just not so. You know, I saw my first ALS reversal about 25, 30 years ago. A patient that was wheelchair bound had a difficult time speaking. And we evaluated him, changed his diet, detoxified him, sent him to a biological dentist to get some dental work done. And he actually got up out of the wheelchair and regained his speech and became normal and functioned several more years till he died suddenly from a heart attack unrelated to the initial condition. So when I first encountered people with ALS that were told that they had no hope of recovering, I thought, that's just not so.
What percentage of the population is afflicted with ALS?
It represents about 30,000 people in the United States. The United States has one of the highest incidences of ALS of all countries. And that's probably because we have such a high level of toxins in our environment in this country.
Beyond the environmental factors, is there an emotional or spiritual constitution to the disease?
Well, yeah, that's 30,000 patients. And, sometimes toxicity in one patient might represent, half of the situation that's going on. And in another patient, it might be primarily mental, emotional, contributing to the condition. But the challenge in trying to reverse ALS is that if you look at the average patient, they'll have about 10 or 12 different causes contributing to their condition, but it's a different 10 or 12 in each patient, and a different percentage of each of those 10 or 12 in each patient. So, you have to have some way of evaluating the patients, usually energetically, to figure out what the causations are and what the best therapies are. And that's one of the reasons why allopathic medicine has had very little success. They try one drug at a time usually and say, well, that one didn't work very much, so let's try another drug. And they've been doing that for 40 or 50 years without very much success. And so in 2023, we had created a integrative medicine educational program for patients with ALS to go through. And we also created an online registry for them to put their data in every month. And we did that through a private membership association so that we could, do that in a fashion where their information was protected, so the information wouldn't get out to the public. And what we saw when we analyzed the data after March of 2024 was that about 20% of our 45 patients had improved during that year instead of worsening.
Wow.
20% of our patients remained stable during the whole year, which is also unheard of. And about 20% of our patients lost only one 1 to 4 functional points during that 12-month period, even though they were expected to lose 12 points of functionality during that 12-month period. So 60% of our patients did better than what was predicted from the peer-reviewed literature. We presented that at the American Neurological Association conference in Florida in September of 2024. And now we're in the process of putting together at least a 500-patient study to try to figure out what worked. We know something worked, we just don't know exactly what worked.
Wow. How cumbersome is the protocol? Is it doable for the average person?
Well, that's the point. Is it's not truly a protocol like you usually think of a protocol. What we do is we educate the patient about the various causes of ALS, and then once they learn enough about that and talk to their health practitioner about that, they decide whether they want to do something about that particular cause. And if they do something about that cause and they see some improvement in their condition, they say that was a good choice. If they tackle a particular cause and treatment for it and don't see any change at all, they say, well, I guess I need to try something else. And so it's a bit of a trial and error type process that they go through with this particular study design. That we're not dictating any treatment for any patient. We're just educating what's possible. And so then each patient thinks about it, talks to their family members about it, talks to their health practitioner about it, prays about it, and then decides what they're going to do. And so it's a self-directed program.
It's a terrifying disease, and it's crippling, and one that has wreaked tremendous havoc in people's lives. If people wanted to participate in this program, and that's why I invited you to do this brief interview, how can they get a hold of you? How can they register to participate? Who would they contact?
Yeah, they can't register to participate in the research project yet because we're in the process of going through an institutional review board protocol. Review board process is better terminology, so that when we finally get all the patients, when we start enrolling patients and get everybody putting their data in every month, we'll be able to analyze the data and publish in a peer-reviewed journal. Almost all peer-reviewed journals now demand that you provide proof that you've done an institutional review board research protocol with human subjects before they will allow publication of that research. So what people do between now and then is they go to healingals.org, and they click on the Start Here. And the Start Here takes them to some testimonials about people that have reversed their own ALS condition. It takes them to the information about the Essentials Education Program, which is a 7-step training program. Some of the basics, basically, like diet and detoxification, and mental work, emotional work. And then after they've done that, then if they choose, they can start working on the 47-step training. All of that is done right now as a private membership association. So at some point, people that are in the registry doing their private membership association data entry every month will be given the opportunity to apply to become a participant in the research project. The reason that a person would want to become a participant in the research project is when we get to 500 patients, we're going to allow patients to query the entire database to find out what's working for other people. And then based on what they learn from what's working for other people, they can decide whether they want to try one of those things on themselves to see if they can improve their condition.
Wow. So far, how many people have you and the team been working with? I know you've had a pilot program going.
Yeah,
how many people have participated, and what kind of feedback have you gotten?
Yeah, there was more than 45 people there were 45 people that entered that data from March of 2023 to March of 2024. And after that, the word got out from, the the presentation that we did at the American Neurological Association and other sources that we were having success when the rest of the allopathic medical community was not having any success. And so as a result of that, there's been quite a few additional people that have become private members of the Private Membership Association and started putting their data into the registry. I think there's probably about 100 now, maybe a little more. Our goal is to, as I said, reach 500 patients for the study when that finally starts. And it'll be an easy transition for people that are already members of the Private Membership Association we think, to transition over to the research study, because there really won't be that much different compared to what they'll be doing between now and then and when they finally start the research study.
So for our listening audience, if they are afflicted or know someone who is afflicted with ALS and they've tried conventional methods, they can join your education community and begin to implement the process now.
Yeah, they can become a member of the Private Membership Association and start participating in the education process and become a candidate for eventually being asked to participate in the research if they choose.
What are the symptoms, and are you familiar of anything specific that triggers? We've been through obviously a complicated 3 years, a lot of propaganda, a lot of misinformation, a lot of lies, a lot of deception. A lot of toxic, literal and figurative information flying around. And I wonder if any of those things would afflict people in such a way that it might predispose them to ALS.
I think the analogy that I've made in the past to patients applies really well to ALS. So I'll give that analogy in a minute. But as far as the symptoms that they develop, very commonly, they develop a dysfunction in an extremity first. They get to where they have a hard time getting up out of a chair or walking normally without tripping over their toes, or they have a difficulty with buttons or holding utensils at the table, picking up a glass. So some of them start with what we call limb onset. That's what I just described, where they have a problem in one of their 4 limbs. But others develop what we call bulbar onset, which is where they develop difficulty with speech, and then they start developing difficulty with swallowing saliva or food, and get to the point where they can't chew or swallow, so they have to get a gastrostomy tube put in to be able to get enough nourishment to not die from malnutrition. Most patients eventually lose their respiratory muscle strength and have a progressive loss of ability to get enough air in and out. And a lot of patients end up having to get put on some type of mechanical ventilation or have a tracheostomy put in their throat to be able to shorten the airway and get oxygen into the lung, or get air into the lungs better. So those are the most common symptoms. They lose their speech very often, where they can't communicate with anybody. We had a fellow that became part of our group that had no ability to move any muscle in his body except for his eyes. Okay, so he was communicating with what's called an eye gaze device that I think was developed by a previous ALS patient, Stephen Hawking, who's now deceased. But anyway, he could not chew or swallow, so he had a gastrostomy tube. He could not breathe on his own, so he had a tracheostomy and a mechanical ventilation 24 hours a day. So he was pretty incapacitated, but he started studying different types of integrative therapies that could be done to improve his condition, including a lot of mental and emotional work that he did. Thank goodness, he when he was near his worst, he married a beautiful woman that loved him irrespective of his disabilities, and got to work finding solutions to take care of her new husband. Between the two of them, they found solutions, applied those solutions, and he got progressively better to the point where he got his gastrostomy tube removed, he got his tracheostomy tube removed, he got got off of ventilation 24 hours a day and now uses it very rarely, maybe a couple hours a day, and is now able to speak and chew and swallow and use his arms and legs and do things that other people would do, walk on the beach, climb stairs.
It's amazing.
So he is an example of the reversal that is possible, even when you get to the point where it looks like reversibility is not possible. The neurologist that was working with him said, "You don't have any hope," okay, and tried to steal the last little bit of hope that he had. Okay, I call that a nocebo effect. Most people are familiar with a placebo effect, which is expecting something good and seeing something good because you expect something good. But a lot of people are not familiar with the nocebo effect, which is expecting something bad and seeing something bad because you expected something bad. Unfortunately, a lot of times people with ALS expect something bad because of what their neurologist told them. The doctor is supposed to know something because he's taking care of other ALS patients, and if it was possible to heal, he would have told me, wouldn't he? Well, maybe he's not aware. Our goal is to get the word out in the public, in the research media, research publications, so that more and more neurologists know that ALS is not an irreversible fatal condition like they tell the patients right now, but that it is a treatable, sometimes reversible condition that, even if it doesn't kill you, you might be able to live peaceably with it for decades, okay? Which is also a decent option.
Without crippling every facet of your life.
Right. Yeah, so if you still have some function, then you can still enjoy life.
Do you use the TKM method that you and I discussed? And I did a podcast with Glenn King, and I was wondering if you use his techniques in your protocols.
Yeah. Well, I encourage every ALS patient to do it, at the very least, the stress reduction technique, which includes using their right hand to hold their left index and thumb. Even if they can't do that maneuver on their own, their caregiver can put their right hand around their left index and thumb and lay it in their lap. And as long as the right hand is touching the nervous system meridian and the neurotransmitter pathway and the lymphatic pathway of the left index and thumb, then they will still get a benefit when they do the rest of the technique. The rest of the technique is to deep breathe as deeply as they can, and that's an important thing for them to keep practicing every day because, as I said, that's one of the most common causes of death is as they get to where their lungs won't expand enough to bring air in and push carbon dioxide out. And so while they're holding the left index and thumb and breathing as deeply as they can, then they close their eyes and visualize themselves in a really relaxing place in nature and try to remember that place with all of their senses: sight, sound, taste, touch, and smell. One of the things that we find with ALS patients is that they're all under stress. Sometimes the stress is mental, emotional, but oftentimes it's electromagnetic or chemical or microbiological or structural or some of the other causes of stress. And this helps to deal with all of those. It doesn't distinguish between one type of stress and another type of stress. It helps to reduce the effect of stress on the body from all of those causes. So I find that that's really, really important.
As a practice, if the listening audience takes their right hand, holds on to the index and the thumb, places it on their lap.
Yeah.
Left side, holds the left side, places it on their lap 2 or 3 minutes before every single meal. It'll have significant consequence on the health of their gut, which is instrumental in dealing with disease.
Yeah, absolutely.
So that's something basic.
Yeah. Ideally, in the beginning, you do it for about 4 minutes, but after you've practiced it daily for about 4 weeks, you'll find that you can actually go down to 3 minutes and still get sufficient effect. And after another couple of months, you probably can go down to 2 minutes and still get sufficient effect. But in the beginning, you probably need to do it at least 4 minutes because it takes some time for the energy from these pathways to dissipate into the palm of the other hand and be carried away to other parts of the body where it can be beneficial.
Yeah. I have a patient under 40, breast cancer, and it's metastasized to the lungs, the liver. I forgot what other organ right now, but we've been doing the TKM method her husband has. I went in and I did a scan to figure out what her body was holding on to as she's gone offline. She can't speak. And he just calls 2-3 times a day. Our producer, executive producer, Jonathan Boyce, has been instrumental in teaching him the techniques that he's learned from Dr. King and the techniques that you shared with him. And I want to tell you, it's unbelievable. If we weren't witnessing the consequence of some of these techniques that we employed, both the scan that I did for them so he can understand what her body's holding on to, and we can determine a lot of emotional and spiritual mind, heart, will, conscience, stagnation. I was able to do that part of it, and Jonathan was able to help him through the TKM method that you've been coaching us on. And he was able to do that. So I just want to encourage everyone listening. There's a number of resources that we have available by way of education, right? For you to learn.
Yeah.
He has been so encouraged by what he's seeing. He said, if I wasn't experiencing it and feeling it with my very fingertips, my hands, I wouldn't believe this. And today she started becoming far more responsive. She's breathing on her own. They're able to take her off these other life-sustaining systems. And what's been fascinating is the curiosity of the nurses, and some of the doctors, as we all know, become hostile because they don't know. And they feel a little threatened by it. But the ones that are curious, I tell you, one person at a time, we can turn this thing around. And I believe there's a new season upon us here in America, thanks to the work and the efforts of everyday people that have just shown up and used their voice. I think if we can be faithful and consistent in being strong and courageous, and if we're willing to learn new things and then teach it. What do you always say? Learn it, do it, teach it. What is it?
See one, do one, teach one.
Right. And you can do that with your child. You can do that with your spouse, right? So these techniques are phenomenal. And I'm glad to hear that you're using this as a protocol, because that's something very accessible. For example, if somebody can go back and listen to the conversation, the podcast we did together, and certainly several podcasts you and I have done that helps people begin to displace some of the confusion, chaos, and dis-ease in the body. And he's sitting in the hospital with her anyway, right? What else is he going to do? This has caused him to realize the power he has within his hands to heal. Yeah. It's a remarkable thing to witness.
Yeah. The Bible says, lay hands on the sick and pray for them that they may be healed. Okay. So why not do that? That's just a common sense thing to do. All you're doing is following the instruction in the Bible. If the hospital says you can't do that here because it's against hospital policy, you say, well, that may be so, but my policy is to do whatever God says to do. And it says right here in my word, and I'll show it to you if you don't believe it, that I'm supposed to do this. And I'm going to do that whether you like it or not.
It's an unbelievable thing to witness the power that you have in your very constitution if you're willing to learn. And if you can be curious and patient with the learning process, it's amazing what you can do to help people you love heal.
Yeah, we need to learn that we're not just a bag of bones or a bag of chemicals, but we're a very sophisticated instrument that God created that is physical body, mental, emotional body, spiritual body. And the bulk of the allopathic medical community only pays attention to the physical. They don't pay much attention at all to the mental, emotional, and none to the spiritual. What I learned a long time ago is that there's a hierarchy of healing. If you have a physical problem, you work only on the physical level, it's going to take a lot of time, a lot of money, a lot of energy, a lot of effort. And if you stop prematurely, it's going to have a high probability of recurrence. But if you work on the next level up from that, which is the mental emotional level, it's less time, less money, less energy, less effort. And if you stop treatment prematurely, even a lower probability of recurrence than if you're working on physical only. But if you go all the way to the spiritual level, it's the least amount of time, money, energy, effort, and the lowest probability of recurrence if you stop treatment prematurely. So I think that we need to start at the top and work our way down instead of starting at the bottom and working our way up.
100%. While you were speaking, I was reminded of Dr. Sabat that said, as long as a conflict remains in the mind, the heart, the will, the conscience, and it's processed and wrestled with there, it stays psychological. But if we neglect that facet of negotiation, if you will, that facet of reconciling the conflict between our mind, our heart, our will, our conscience, then the conflict becomes biological. And then we're looking at cases of disease, various cases related to the very specific conflict, emotional conflict. But I am just thankful that you mentioned the spiritual component, because that's where we see a full sweep so often that comes in the form of healing when people are able to reconcile that conflict sooner than later.
Yeah.
We're going to have a lot more discussions around that, but the work of Steve R.E.S., that we've recorded several segments with him, Healing Frequencies, touches that. And of course, previous podcasts that you and I have recorded address that issue. But I am so excited about this ALS venture and the ability to invite our guests to join you, to rally with you, to participate, to bring their loved ones. And it'll change them from the inside out. There's hope. There's hope for healing.
Yeah.
There's hope and healing.
Yeah, it's very rare to find an untreatable, incurable condition, but I have found quite a few incurable people because of their belief system. Okay, so if they can get the negative beliefs out of their head, then I believe that most physical conditions are, curable.
Hippocrates, are you willing to let go of the things that are making you sick? And that's a profoundly important question. Many people, frankly, do not have a will to live because of all those unreconciled conflicts. They just don't want to die. So we want to help people flip that mindset, turn it around. And we do it. We do it all the time. So I'm excited about 2025. I'm so thankful for everything that is before us. So on this inauguration day, the optimism and the hope and the energy, frankly, that I'm hearing from so many people all over the country in so many walks of life, regardless of political orientation, especially those that are being educated by functional practitioners that have been on the front lines of these discussions for 30, 40, 50 years like yourself. There's so much hope, and I think there's a great awakening.
Mm-hmm. Yep. There is awakening going on in multiple levels, so it's really good.
Thank you so much, Dr. Cowden. Before we close, would you tell everyone how they can reach you, how they can join again?
The people that have ALS, or they have a family member or friend that has ALS, those people should go to the healingals.org and click on the button that says Start Here so that they can become educated about what's possible. I've been retired from patient care since 2019. My primary focus now is trying to move this ALS research forward and to also educate as many people as I can about integrative medicine, especially as it relates to neurodegenerative diseases. And so a lot of the things that I've taught in the last 2 years are actually on the healingals.org website. There's also the information that we taught prior to that that's on acimconnect.com. acimconnect.com has a few free things, but most of the things that are on there you have to pay something for. But there's some excellent integrative medicine education on there as well. But on my personal website, I have everything on my personal website is free, and I have only a few things on there. Some articles about how to identify mold or fungus in your house, how to get rid of it in your house, how to get rid of it in your body, how to do the stress reduction technique that I mentioned a moment ago. There's a really good article on there about visualization, shouting, and forgiving, which helps you to resolve a whole lot of emotions without the aid of a psychologist or any other kind of fancy equipment. And then there's also an article on there called What is Spirituality, that I think a lot of people would benefit from reading that and understanding that there is a creator and the creator cares about us. And so there's plenty of proof in that article about that. So drleecowden.com.
Okay, drleecowden.com.
Yeah.
Well, and you're a regular guest here. I could not have advanced the cause of rest as we have without your leadership, without your mentorship, and your tireless commitment to facilitate healing. Thank you so much.
Yeah, well, thank you for putting this podcast together. Hopefully it'll reach people that need to be reached.
No doubt.
Yeah.
God bless you. Thank you, Dr. Cowden.
God bless you too. Bye.
We hope listening to this episode has brought you closer to experiencing the freedom of wholeness and healing. If you have questions or comments about today's episode, or for updates about R.E.S.T, please visit our Instagram or Facebook at The Place of R.E.S.T. If you would like more information about Virginia, or to support and join the cause of R.E.S.T, please go to theplaceofrest.com/donate or call 949-289-5935. Thank you for listening to Rest with Virginia Dixon. We'll see you next week.